I chose to nominate Evelyn because I've never met a person that I think has greater resolve, ever.
Evelyn is the most mission-driven individual I've worked with in my career. I don't see that anybody will surpass that drive.
Her level of selflessness is something that I aspire to.
I live in Fremont, Nebraska, with a wonderful husband, Tom, who's a family physician, and 3 grown sons. We have 5 grandchildren, another one on the way. I worked as an audiologist for 28 years, but now I'm a patient safety advocate. In 2000, I was diagnosed with breast cancer, had chemotherapy, everything seemed to be going well, but within 6 months I had a recurrence. So when I had that recurrence, we knew that this was really a serious, life-threatening situation. So we consulted with a number of centers of excellence and determined that I'd have to have a stem cell rescue, which is a very arduous procedure. In the workup for that stem cell procedure, I was diagnosed with hepatitis C. And the CDC, which did a very thorough investigation and determined that 99 Nebraskans contracted hepatitis C through that same chemotherapy clinic because the nurse reused syringes during the administration of chemotherapy. We had placed our confidence in this medical facility, and so this was something that just shook all of us to our core. How could this have happened?
She kept telling the insurance company that she didn't want the money, she wanted the practices improved.
We used my settlement award to start a foundation, Hepatitis Outbreaks National Organization for Reform. Our mission is to advocate and educate about injection safety, because as outrageous a situation as ours was, we weren't the only time that this has happened in the United States. The CDC estimates there's been at least 50 outbreaks like ours where a healthcare provider reused some kind of medical equipment that was intended for one-time use but was reused. And so we spend our energies educating healthcare providers and consumers about the critical need for safe injection practices in all facilities at all times. The One and Only campaign is 1 needle, 1 syringe, only 1 time. It is a very robust campaign. We're just so proud of that campaign and the good work that the CDC and many partners through the Safe Injection Practices Coalition, what has been done to bring awareness about injection safety, not only to the United States, but globally.
She hit the ground running, and she went out into the country and eventually the world to spread the message of injection safety.
We're all in this together. Healthcare providers are patients too, and so we all want to work together to make sure that all injections are safe in every facility, every time.